Okay, sorry about that, everyone. I thought I was,
No problem.
okay, we've gone through the global handbook and we're on the international SOS. So the numbers that I'm talking about are the dedicated telephone number and the membership number. So those are the two numbers that you should put into your phone to contact international SOS. Students would have, most of you would have already gone through the Canvas course and seen this information. If you didn't put it in at that time, this would be a good time to do it. I'd also like to draw your attention down to the bottom of the screen. The Global Experience Office also has an emergency response line that is manned 24/7 by somebody in our office. I believe for the time that you are away, that we have somebody each week. At the end of your stay in Costa Rica, I am going to be on the line. But we'll either have Colin Waters, who you just heard from a few minutes ago, as one of the respondents, and or Candice Ruda or Kristen Miller, who are also in our office, may be on the phone. So you'll be able to reach one of us through that number at all times. And if we don't respond within a half hour, then we do suggest that you call campus police, but most of the time people get back to you immediately when you call that number. International SOS also offers an app, and we do encourage students in the Canvas course to download the app. I'm not going to go through how you do that now because, like I said, these slides will be available to you after my presentation. It's pretty simple to do. It gives you a one-click to call the assistance center, the ISOS Assistance Center, and talk to medical or travel experts. So in addition to the website, this is probably a good tool. It also has the ability to have to allow students to participate in a check-in so that we can send out information, or we can send out a request for a student's location, and with one click they can check in with us. So if there is any kind of security situation in country, we would send out just a message through this app, and you would be able to kind of give us a one-click "I'm okay" response. So this is a really great thing to have, and it'll only take you a minute to download. So on to our pre-departure and the COVID related requirements. So in order to travel, according to WPI policy, you must have a negative COVID test 72 hours prior to your departure. And that test, if you are on campus, that would, and part of the testing protocol, then you could have your test 72 hours prior to leaving, and then you would have the results of that test and have that available with you as proof of your negative test. You don't need that to enter Costa Rica, but you will, but you do need that to travel according to WPI policy. If you are not part of the protocol, you may take a rapid antigen test such as Binax Now, and if you keep the negative results, either a picture of the negative results or another indication that you've tested negative, so that you have that documentation. You must be fully vaccinated to travel, and at this point that includes a booster. So right now there's still availability in the clinic that WPI is sponsoring today and tomorrow to be boosted. So if you haven't had the opportunity to do that, I suggest that you look into that and make an appointment to have that done now. If for some reason you are not qualified to be boosted right now, please contact our office so that we know the situation, and we can try to figure out how to help you handle not being boosted. Students who cannot travel due to vaccination status, and that means any student who is not fully vaccinated, may delay arrival until they are fully vaccinated, or if they're unable to become fully vaccinated by the time that the project is completed, then they will be allowed to participate remotely. So we had asked you previously to complete an intention survey about whether you would be participating in person or remotely. If your status there has changed for any reason, please contact our office and let us know. We would like to make sure that any student who's not traveling and is participating remotely, that their team gets the support that they need to have the sort of hybrid team. So other pre-departure COVID preparation, to US citizens traveling to Costa Rica must complete an epidemiological health pass. And I know that Professor Pete sent a link to that in one of his emails. I will also include the link to that in the follow-up email that I'll be sending to you in case some of you have not completed that information. If you are fully vaccinated US citizens, which anyone traveling for WPI will be, you must be able to have proof of full vaccination with you. So don't forget to bring your cards or to have your information on your phone. Or I believe there's a website that you can go on to get your vaccination information. I don't have that information now, but I can look it up and send it to you, send it along to you also. So if you don't currently have something, make sure that you get proof of vaccination to take with you when you travel. For any student who has previously had COVID and is on a 90-day exemption from testing at WPI, you'll be responsible for securing a certificate of recovery from your treating physician. That will be your documentation for travel. You will need to take that with you. You will not need that to enter Costa Rica, but you will need that to return to the US. So you must carry that certificate with you when you're traveling. If you are in need of a certificate of recovery and do not have one and are not sure how to secure one, please make sure that you contact the DO office so that we can set you in the right direction for getting that in time to travel. So we're going to ask you to be very vigilant in Costa Rica. We know the numbers in Costa Rica are not what they are in the US. The exposure is not as great, but we do not want you to reduce your vigilance. It's still very important to you, your teammates and the rest of your cohort, and to the completion of your project that you try to remain healthy throughout the time that you're away. There will be no regular testing such as we have on campus while you're away. So we are asking you to be vigilant about how you feel and whether you feel symptomatic or if you're feeling it at the first signs of feeling less than yourself, that you take notice and bring a thermometer for testing for fever. That's one of the first symptoms that you would notice, and it would allow you to test and allow us to make sure that we're mitigating the spread of potential COVID to the rest of the cohorts. We do recommend, if you have access to them, to bring additional, Sarah, yeah, if you want to pop in here.
Yeah, I just wanted to make sure that we were talking about the fact that, because you said no regular testing, and I just wanted to qualify that, not regularly weekly, but we are, of course, requiring these tests at the beginning and then on to your extra rapid tests as a good recommendation for people to bring.
Thanks, Sarah. So at the first sign of any symptoms, or if you're just not feeling well, we do encourage you to test, because the sooner we know the results of a test for a student who is presenting with symptoms, the sooner we can make arrangements to isolate and to protect the rest of the cohort. It's going to be very difficult. We know you're going to be all living and working together. This is a very contagious disease. We know that it's likely that somebody will test positive, but we would like to mitigate the spread of it as much as possible. We're going to continue to ask that you follow WPI policies regarding masks. And at this time, it means no cloth masks except over a tightly fitting surgical mask. And we highly recommend tightly fitting N95 or KN95 or higher masks. Right now, I know you can pick up 1 or 2 of those masks in the testing center in Harrington. I did so myself this morning, and they had stacks of them there. So if you don't have one, pick up 1 or 2 now, and make arrangements to maybe get a couple more just in case you lose or they become overused while you're there. We would like to continue to see you masking while indoors and unable to distance outdoors. You'll have to come to some kind of agreement within your housing as to what level of masking. But if students start to feel symptomatic, I would say, start masking immediately. Both the student who is feeling under the weather and those that have close contact. This is all spelled out in your handbook. It will be in the new COVID information that I've added to the handbook and will send out after this presentation. So I know that that's a lot of information to take in, but most of what we're doing while you are in Costa Rica is pretty much on the same lines as what you've been doing here at WPI. But I think the concern with COVID here is how it affects travel. And one of our main concerns is how it may affect your travel if you test positive prior to departure or near your time of departure from Costa Rica. This is something that I know is probably a concern of yours. I'm sure it's a concern of parents, and it's definitely a concern of your advisors, your director, and our office. So I want to go over this, and I'm sure you'll have questions, and we can probably open this up a bit. If you test positive prior to your departure from Costa Rica, and you will need to test before you board a plane to the US. So whether you are leaving on time or right after your project time ends, whether you're staying the extra weekend to do a little bit of traveling around Costa Rica, you will need to test before getting on a plane. If you test positive at that time, or in any of the 14 days before you're scheduled to leave, you will need to isolate for 10 to 14 days. So if you are currently still part of the program and your advisors are there and you're still in the WPI sponsored housing, they will make arrangements for you to isolate. in an area close to your accommodations, or maybe even in fact be able to stay in your accommodations, and maybe your roommates maybe move to another area. That will all be worked out depending on close contacts and the availability of housing. If you test positive after the WPI housing deadline, so when everybody's out of there, we will need to make new arrangements for your isolation. So you will need to immediately contact the Global Experience Office. You will need to immediately contact your advisors, and we suggest you contact International SOS. That will allow us to work to find you a place to isolate, to get medical assistance in order, because you will need to have a certificate of recovery to re-enter the US. So we would need to get you a medical professional to handle your care, who would be able to give you the certificate of recovery. You will be responsible for all costs related to a positive test prior to your departure. And that includes testing, additional testing, that includes any healthcare visits, accommodations, and flight changes. So if you choose to travel in Costa Rica after February 19th, you're accepting certain risks involved in staying longer. And those risks could include testing positive for COVID and needing to find accommodations and healthcare while your advisors are back in the US. You will have our help, like I mentioned, but this, I know this can be anxiety producing just thinking of that happening. So if you'd like to talk about that, we can do that. And we're asking you, if you do travel after the housing is closed, to try to mitigate your exposure by, going to the beach with outdoor activities, and to reduce your inside unmasked activities if possible. I don't know if we want to continue on to health and safety, but I think this might be a good place to just take a few questions right now, if we have some about this.
Idea. I mean, it could be something that we get carried away with, but like you said, a few questions.
Right.
And I will note that in Costa Rica, that 90-day recovery, or that letter of recovery from a doctor, it is a thing. It's something they understand. So you should be able to get that. I found that briefly just starting that search.
Mm-hmm.
And I think that this is something you'll talk about with your group of people you're traveling with, but maybe try to identify some houses that you would stay in if you did test positive. You don't have to book them, but just sort of having an idea of other places you could stay and thinking strategically about when you want to test. So both airports provide a place to pay for a test 4 hours before your flight, but then you're in the city. You might want to find a place, well, and we're starting to collect this information of where you can test in other places. So knowing where you're going to travel to during that weekend will be really helpful for advisors. So we're gonna ask for that information fairly soon. But so if there are other questions, I just wanted to throw those in.
Yes, and so my teams have a place in the spreadsheet with the departure and flight information. There's a second sheet for your travel locations and what you're doing. So again, it's the same one we've been using. And you can enter that information again so that we have a little bit more clear idea of what you're doing and who you're traveling with and things like that. And then you also will know who's going where and can coordinate.
And that health pass, you're not able to fill it out until 72 hours before your departure. So definitely understand how to access it. Know that you're going to have to upload digital copies of things, but it's something you'll have to do at the last minute. So do make some time for that. Any other testing questions? We'll also open it up again at the end.
I have a quick question.
Great.
If you had COVID over break, so the PCRs are still going to come positive. So would like an at-home rapid be okay, or do I have to get it like from a doctor to go home?
This is where so if you already had COVID, you're going to need that certificate of recovery to bring down to Costa Rica with you and travel
Okay.
back with. But hopefully it's within the 90 days. And
Okay.
I think that you're not even encouraged to take a test because it will likely be positive. But if someone is testing negative, you're welcome to just, know that you're going to test negative, do that test, and then just use the negative to leave. But does that answer that?
Yes, I think so. Thank you.
Colin, did you want to pop in here on that, or?
Oh yeah,
No,
Colin's here.
Thank you. I think Melissa and Deb, you've really done an excellent job in relaying that information. For those of you that don't know me, my name is Colin Waters. I work in risk management with the GEO office. I just want to make everyone aware that while COVID is a concern, no WPI student to date has been hospitalized due to COVID. So this just becomes a logistical challenge of having you stranded in Costa Rica for a period of time, waiting to get that certificate of recovery at the end. And I think the real message throughout is just as best as possible, especially at that tail end of the project center period when the accommodation and housing is finished and you may be traveling independently, just to mitigate as best as possible the risk by wearing these tightly fitted N95, KF94 masks or better, minimize your exposure inside, and just informing your advisors, letting people know where you are. And while you may be isolated or with a group of students that have tested positive, we are here to help you as best as possible, but just try and minimize that risk, especially towards the tail end of the period, as much as you can.
I also, Skylar, just to go back to your question, I think it's probably, if you want to take a test, that's fine. I think it's a good idea to take a test, but I don't want you to rely on a negative test, because if you then go to Costa Rica and then for some reason the test that they use is to come back into the US, say you used a rapid test and you had a negative result, but you're coming back from Costa Rica into the US and you test positive there, you're going to want that certificate of recovery at that point. I just think it's a little bit more safe to assume that you're going to test positive and have that certificate of recovery than to kind of gamble on a negative test coming back. That's my thought on that.
Okay, thank you.
Yeah.
I just got one quick question pre-departure wise. Let's just, in a hypothetical sense, say that you test positive and you do your, whatever the US says now, 5-day isolation, and then the next 5 days in a mask or whatever the rules are. Are you still allowed to travel within those second half of 5 days?
You're not allowed travel within those second half, that day 6 to 10, Michael. The CDC recommends that you do not travel between days 6 to 10, avoid traveling. And that's what WPI is putting in as well. So if you do test positive, you would have to wait out the full isolation.
Okay, thanks.
Thanks, Michael.
Thanks, Colin. Okay, I'm going to move on right now because we still have some health and safety information to cover. And then if you have any more questions at the end, we can once again go over them. So another, before you leave, if you are currently taking any medication, prescription or otherwise, you want to make sure that you have an adequate supply for your stay, because not your medication may not be available where you are in Costa Rica. When you're traveling with medication, both prescription or over the counter, make sure that it's in its original container, appropriately labeled. And it doesn't hurt to bring your prescription with you to have when you're traveling, just in case. So the other health and safety things that we are going to go over are the top travel risks for US students abroad. And there are these 6 top risks. We're going to just quickly go over them one by one. If you have any questions, we'll answer them at the end. Just a few things that we want you to be aware of. So the #1 travel risks for students traveling abroad are road traffic accidents. That is why we do not allow students to drive while on international IQP. So there will be no driving when you are in Costa Rica. You should also be a cautious passenger. If you are using a service, please make sure that it's a reputable transportation service. And that goes for while you're in there, during your project time with your advisors, and after, when you are touring alone. Please make sure that the transportation you are taking is a reputable service, and it wouldn't hurt to run it by your advisors prior to use while they're still in the country. We're also asking you to be a cautious pedestrian. So just be careful when you're walking across roads or along roads, or that you're watchful. The next is opportunistic crime. And usually this, we see a lot of this in project centers where students have cell phones taken, or a backpack that they may not have been keeping an eye on gets picked up. There's usually, it's usually something that you notice later, or it's something that happens quickly and, doesn't really pose any safety issues for you. It's just a loss of your personal property and a pain in the neck to try to recover. So keep a low profile and keep your cell phones out of sight when you can. Don't walk around with a brand shiny new nice cell phone. Use the buddy system and keep an eye out for each other and for your possessions. If you do if you do come across someone who is forceful and asking you to surrender any of your personal items at any time, do not resist, just hand it over. Your personal health and safety is much more important than any of the things that you might own. So we're asking you to just give in, and then deal with the consequences after. We do not want you to in any way resist and put yourself in danger. That's basically we would expect this kind of behavior anywhere around here. We sort of get lax sometimes in our home places because we think we're so safe because we venture out. And you could start to feel that way also in wherever you are in Costa Rica, that it's very touristy, it's a safe place to be, and we agree with you. But that does not mean that you can't, that you might not become a victim of a crime such as this. So just be on the lookout. Pre-existing health conditions. A lot of you right now have some pre-existing conditions, whether they be allergies or other illnesses, and I'm sure that you probably have them managed very well. We assume that you'll be able to manage them while you're away, but have the same support that you have here. Your situation is a little bit different. So I want you to think about how you might handle any of your health concerns while you're away. The number one thing we ask you to do is to complete your Geo health forms and complete them honestly. We don't keep students, we don't prevent students from going away because of information that they put on their health forms. It's really important that we know if you have health issues so that we can get you the help that you need, the appropriate help that you need, and as quickly as possible. Keep your advisors and us informed if you start to feel illness of any kind, not just COVID related, if it's something you've been dealing with for a while, but it starts to flare up when you're away. If you start to have allergies, just let us know. A simple email to your advisors would be sufficient if you're experiencing seasonal allergies, because you're going to be in a completely different environment and you might have allergies that you've never experienced before. So just let us know. We'd also like you to share any conditions, especially severe allergies, with your cohort, so your colleagues can help in an emergency. So if any of you have life-threatening allergies and require EpiPen usage, please let other people know. There should be no embarrassment if you have an allergy. The people are willing to help, and the more informed they are, the better able they are to help you in the case of an emergency. So if you do use an EpiPen, let somebody know, let many people know if you feel comfortable with that. And if you're willing, train them in usage. That would serve you best in the event of an emergency if you knew that your cohorts were aware of your allergy and knew how to help you when you most need it. And for all of you, in the case of a life-threatening emergency, call 911. You don't really have to determine if it's life-threatening. If it seems like it's severe and you're nervous and don't know what to do, call 911. You don't want to stand around and wait and try to evaluate, is this life-threatening or is this not? Just call. It's better to err on the side of caution than to wait and while somebody could be getting worse. So never be afraid to just go ahead and step in and do what's required. Drinking, we have a lot on here. Basically, we're asking you to drink responsibly and in moderation. It's very important that you know your limits. I assume most of you are juniors now. You've been in college now for a while. Most of you, I assume, have experience with alcohol in some manner, and you should be aware of your usage and how it affects you and those around you. So we would like you to think about that and to behave in a way that is beneficial to you and your cohort with regards to your drinking while you're in Costa Rica. We're also asking you that if you do go out in a group to drink, that you take care of one another, that you don't leave anybody behind, that you don't let anybody leave ahead of you. That you should do things in groups or at least 2 people. So we just want you to look out for one another. And sometimes alcohol has a way of making you not as responsible, or not, your judgment may be clouded in some ways. So it's pretty important to go over this information and practice it while you're away. And we've found that students who have the respect for the rest of the students in the cohort with regard to safe drinking, they tend to have happier cohorts, and they seem to get along much better, and we don't have to intervene on their teams as much. So it's just important to think about. One of the dangers you may not think about in traveling abroad is drowning. Specifically in Costa Rica, I want to caution you. A lot of the beaches will probably look beautiful, but you need to be careful. There are riptides. Avoid any beaches with strong currents. Always swim sober. Never swim alone. And if you see a beautiful beach and there's no one on it, there may be a reason for that. So you might want to stick to beaches that are more popular, that you would see more tourists at, rather than trying to find an isolated spot to swim. And lastly is sexual assault. We do not, thankfully, have many incidences of sexual assault on our programs, but we do want you to be aware of the possibility and not to put yourself in situations that are unsafe. You're going to be in a place that is unfamiliar to you, and we know that you've had training, plenty of training in the past, but we're asking you to revisit your training because just to go over safety in a new environment, it would be good to just familiarize yourself with your previous sexual assault awareness and prevention training. We have the module in the Canvas course that all of you should have taken by now. And know your resources and reach out for help. The Student Counseling Center has prepared a couple of slides for us regarding sexual harassment or sexual violence. So if you are the victim, or if one of your colleagues is the victim of sexual harassment or sexual violence, and they come to you to talk about it, we've provided do's and don'ts with dealing with somebody who has been with supporting survivors of sexual harassment or violence. So I really suggest that you know where to access this slide, because it has really good advice that Matt Barry has prepared for us in the event that you have to talk to somebody about their experience with sexual assault or sexual violence. Also, it's very important to understand confidentiality and the resources available to both the victim of sexual harassment or sexual violence, or even somebody who has had somebody confide in them. So there are confidentiality, people who are confidential, and this is a little bit hard to understand, that do not have to report any incidents of sexual assault or sexual violence to WPI. And those are, if you go to a hospital in Costa Rica, they do not have to report that to us. If you go to a religious, a church leader or chaplain, they do not have to report that to us. You can get confidential support by contacting the SDCC here at WPI. It won't, your name will not go any further. It will, we will just reporting will be done on kind of a statistical basis. Health services is also confidential. The chaplain's office at WPI is also confidential. And like I said, any non-WPI support services like hospitals, police stations in Costa Rica, those sort of areas. If you do decide to report the incident, I suggest that you, and you want to do it confidentially, then report it to the Title IX officer, and those are listed on the WPI website. If you do confide in your advisors, any other staff, or any other students, we are not confidential. We would need to report that to the Title IX office. And I'm going to suggest, if at any time that you are in a situation like this, please consider reporting, because the amount of resources that become available to you upon reporting to the Title IX office are enormous compared to trying to manage something like this on your own. If you have any questions about this, and you don't feel comfortable talking about them at the end of our presentation, feel free to reach out to me, and I can talk to you a little bit more in depth about confidentiality and resources and reporting. Finally, we want to make sure, we've done a lot of talk about managing your physical health with COVID, and but it's just as important to look after your mental health. This is one of the areas in which students really do not expect to find themselves in a situation where their mental health is not where they thought it would be. It's normal for students to feel homesick. It's normal to feel out of place or overwhelmed. It might be surprising to you, or it might not, if you've experienced other mental health concerns previously. But just know that if you're feeling that, it's not weird, it's not unusual, it's very normal and very it happens very frequently. Support each other, reach out to your other teammates. Sometimes you feel a little bit alone, like you're on your own. Sometimes all it takes is to tell one person that, hey, this is really a little bit tougher than I thought. That could change things right there, just letting somebody know. If you don't feel comfortable going to another student, your advisors are there for this kind of support. So the other thing is, you can access 5 emotional support counseling sessions through International SOS, and that is confidential. You don't have to report it to your advisors. You don't have to report to us. You simply call their number and ask to be set up with emotional support counseling, and they will provide you with 5 free support sessions. If you are currently seeing somebody in the SDCC, you will no longer be able to do that while they're away. They cannot counsel outside of Massachusetts, but you may want to talk to them about how to manage any kind of mental health concerns that you might have off campus, and to contact International SOS prior to leaving for Costa Rica, to ask them what kind of support that you can receive in country. Not only the 5 free sessions, but they may be able to contact a counselor in country for you. Okay, so that was a lot, and that's all I have. but I assume that people have questions. So I am going to stop sharing my screen and hopefully answer questions for you as they arise. So February 19th is the last official day of accommodations in Costa Rica, and after that, we're on our own.
18th is the last day. So it's the night of the 17th. So 18th, so that was actually a correction from what you had written before, Deb, because
Yeah.
we have only booked through that Thursday night. So the last full day is Thursday. People are departing on the 18th. I mean, they could stay in Monteverde or San Jose too, but the housing ends the morning of the 18th.
Okay. And I saw that there was a question about testing prior to departure from Costa Rica. And I think, Melissa, you have materials that say, and I believe Creighton, you may have sent it out, that across the street from the airport is testing center. Am I
There's
correct?
testing at both airports in like tents beside them, and they offer shuttles to get you from the testing facility to the airport. But people probably want to consider testing the morning before your flight so that you're not at the airport. I mean, that is an option, but we're starting to compile places where if you go to Monteverde or you stay in Monteverde for your final weekend, or if you go to Tamarindo or you go to Jaco or Capos or Arenal, there are places to test there. They're not necessarily like Monteverde, it's a little bit tougher than say Tamarindo or Jaco or Capos. So if you did it the morning before you leave, that's within your 24 hours. And we can provide some info on that. And then, so that, yeah, the 72 hours before has changed, but who knows what it'll be in a month or so. And how about Will?
Hi, so I'm in a similar situation to one of the people that mentioned that they tested positive for COVID over break. So with that certificate of the certificate from my position, I think it was called certificate of recovery. Is that something like, do you think I can just like message my doctor and then get it printed here and then I'll be fine with that? Or is that something that's going to actually require me to go into my doctor? I imagine I could do most of it virtually.
Yeah,
Colin, do you have experience with it yet?
I can tell you we had a student in Venice that was in the same situation, needed one to get out of the country. And I think it was all through telehealth. There was no formal visit to the doctor's office. That may be different given your situation or what your timeline is like, but I would contact your PCP as soon as possible, let them know the situation. And it's just very important if they are, your document of recovery is what it's called. It's two things. It's the document from your doctor saying that you've exited isolation and that your name is the exact same name that's on your passport. So make sure that your whatever your middle name, etc., it must be identical to your passport. So that's one piece of it. And the second piece of it is your actual positive results. So you have got a positive test, and that's documented. So I don't know in your situation, Will, did you just take a rapid test or did you have a formal PCR test? If you got a PCR test at WPI, then you can actually print that out, and that will do as part one of that document.
Yeah, it was a rapid test administered by a medical facility. So
Okay.
I think WPI recognizes it as
Yep.
like a formal test.
So
yeah.
For me to clarify, that means you need that positive test verification, but you still need the doctor's note.
Absolutely.
Does the doctor's note need to say that you now don't show symptoms? And then it has your name perfectly.
I'm not sure how all doctors treat it, but yes, it would have to say that you are able to break isolation.
Okay.
So at a minimum, and most doctors are aware of what that is now, Will. So you should be fine. I can send some verbiage in the chat in a minute.
I'm gonna jump, I wanted to jump up to one question that's in the chat before it got buried. Oh, but wait, just to reiterate, if we tested positive for COVID over, I'm reading a chat. If we tested positive for COVID over the break and have that certificate of recovery, are we exempt from testing to come back into the United States? I would say yes. Colin, is that because it's within the 90 days?
That's correct. If you have a
Do everything
full,
Colin just said, bring that letter with you.
yeah, just bring it with you, and you should be exempt because it is likely that you will continue to test positive on a PCR test for 90 to 120 days.
So that's what you will use to leave Costa Rica. And at this point, I feel like people are saying, man, I wish I just got COVID 2 weeks ago. I could skip all this. So there was one more chat question above that says, if it's the morning before, is that a take home? I don't understand that entirely. You will go to a facility to do the test the morning before your flight. There are also some options of bringing rapid tests with you that require you to sit in a virtual meeting with the manufacturer that processes and verifies watching you test negative right there. Colin, do you want to say anything about that?
Yeah,
Students be doing that.
yeah. Ideally, I think, Melissa, did you have some experience with that? And you said that that was not optimal.
I did it, but it was a surprise that I had to do it. And so it was really confusing. And it was, I had to mail it away and it took days to get it back. So I think these would have to be different. These would have to be fast tests that you get an immediate result from, because you can't bring a test that you need to mail the results away. If you're bringing a test, it's one that you process it and get an immediate result. And to travel with that test, you have to have the type where you sit with a manufacturer approved overseer and they verify your result and they look at your passport and stuff like that.
I mean, I would always say the baseline is to get a rapid PCR test at the airport,
At a facility.
because that
And
is the one that's completely recognized at all times. Antigen tests and lateral flow tests are recognized as well, but not all of them. So a little research is needed there.
And since these are 24 hours needed to travel into the States, most of the PCR testing in Costa Rica looks like it's taking more than 24 hours. Just for everybody to know that. So the antigen tests are allowed. And there are a lot of verified labs that we're getting a list together for. And Sam?
Yeah, I wanted to ask, you said we had to get a negative COVID test 72 hours prior of leaving the country to go to Costa Rica. Does that COVID test have to be on WPI campus, or can it be?
No, it doesn't. That's just to make sure, that's an own internal WPI rule, just to make sure students that are arriving in Costa Rica that does not have a testing protocol in place right now are arriving there safely for their other students. So if you are at WPI and you can get a PCR test, excellent. But if not, take a rapid test and just record the results, and do not travel if you're positive.
Okay.
Thank you.
Ulrika's question here about testing positive shortly before departure. As I understand this, Colin and Deb, correct me if I'm wrong, but that is the point at which, yes, we need to have the 10 days of, regardless, in fact, of whether you're symptomatic, we have to follow the 10 days of isolation. And so you would have to leave late. And then with that positive test, you would need to, again, get that doctor's certificate, have all of that done, but we can't have people traveling with positive tests. And at this point, I think we are at the point where that happens. Any positive tests that happen from now are going to have some days of deferral of travel. We were okay till, I guess, yesterday, for people who were asymptomatic and just, starting that isolation, to still have the possibility of traveling on the correct day. But at this point, any further positive tests are going to cause a delay. And so for those of you on campus, no
where you go as Rica wrote, like, do you turn around and go home? So where is your quarantine place stateside, while you're on campus? And for anyone that arrives late into Monteverde, they're going to have to take a private shuttle from the airport up to Monteverde. And Sarah and I can provide some links for that, but that's the type of thing that you can reserve ahead of time, and it loads right there at the airport. And it's like $50. Any other hands out there?
I guess I have one more question.
Great.
About the money situation when arriving in Costa Rica, and what you guys recommend doing for either bringing money there or taking it out when you get there.
I would recommend, which place are you flying into? Which one is yours?
Flying Liberia.
Okay. At any of the airports, you can use the ATM. Check with your bank on how much they charge you to use that ATM. The machine that to use your debit card from that bank, your bank, how much does that cost? For me, for example, I had that credit union, like right up, I'll call them credit union, right up the street on Park Ave near WPI, and it was free to use my ATM. So to use my debit card. So I could always use that. The bank I have now, I get like 4 uses a month for free, but the machine can charge you too. So know that at the airport, it's going to charge you like $5 to use the machine. If you're flying into Liberia, you can, and even into the San Jose airport, you can use US dollars for your taxi. So you don't have to use the ATM at the airports. You can pay your taxi with dollars. And then go to an ATM machine and take out a couple $100s. It's something you don't want to use over and over, every few days. It's the type of thing that you'll take out a couple $100s, see how far that got you. And then the next time you want to take money out, do some equations of how much you went through in that last week or 10 days and how much more you need to get you through the rest of the journey. Consider any gifts that you want to buy before you leave. But it's really easy and getting easier to use a credit card in Costa Rica. So you'll be able to use your debit card in the stores and restaurants and your credit card in the stores and restaurants. If you have AAA, I think it's free. There's no fee in going there and saying, hey, can I get $50 in Costa Rican colones? Or can I get $100 in Costa Rican colones? But I wouldn't do anything that makes you pay a fee. It's just not necessary today to show up with the money in your hand. It's so easy to use ATMs. And traveler's checks, although I'm sure they're accepted and cashed out in bigger places, they won't be very common in smaller places. I haven't used them, I don't know, for sure 20 years. But that's a good question. So we just found out that taxi to the hotel in Liberia will be about $20. And I haven't found out from Tyrona. They always say about $30, but I don't know if prices have gone up to go from the airport. I had a couple points I wanted to mention. When traveling on that Friday, the 18th, to go to the place you were going to go for the weekend, if you're not going directly to the airport, for Monteverde, you're basically going to take a private van because of the time frame. You have a short amount of time. It's not really worth taking the long, slow bus, the public bus, out of Monteverde at 2 specified times that it leaves there. you're going to organize with your group of people that you're traveling with, where you're going to go, and through either Los Pinos Hotel or through the language school, you can organize a van that takes you all directly to that place. You'll be in your own bubble. Same thing for San Jose. If you're planning to travel for that weekend through the Tirona Hotel or through the language school, we can organize small group vans for you to go to the places. If you find that 20 of you are going to one place, we can find a bus big enough to take you all there together. If some of you are going directly to the airport, we can organize that transportation for you together. So you can pay for those things right there at the time, and you'll just be able to get to where you want to go faster. And you can use that same approach to go to the airport with whoever you're flying with around the same time. So feel free to ask any questions about that. And just to go back to Deb's really great points on traffic accidents, remember that pedestrians do not have the right of way in Costa Rica like they have in Worcester. And as you walk around WPI's campus, everyone will just put on their brakes and let you pass, and that will very much not be the case. In San Jose, it is really like fast drivers, cars have the right of way, and you really should be careful crossing the street there. Highly encourage finding that crosswalk, which are not plentiful. But the apartment is close to a big rotary, a big high traffic road. And you take your life in your hands trying to cross that street. There are crosswalks and blinking lights for pedestrians. So we really encourage you using those and keeping an eye out for fast traffic. Monteverde, it's different. It's small streets, but there are not, I haven't been there. They've been building sidewalks. So there are probably more sidewalks since I was there last. Please be aware of that. But at night, it's really dark. So be careful of traffic. They can't see you. And it can be tight if there isn't a sidewalk there. You have to jump to the side of the road. And then the idea of bringing rapid tests with you, it isn't something, it's become more pressing to us. It wasn't something that with a lot of notice we were able to tell anyone, but I do think it's a good idea. Colin, Deb, and I, and the advisors discussed it yesterday, that if you can test 10 days before departure, or 5 days before departure, you'll be in a better position to plan for your delay than if you got to the airport and were positive. And the other point is that you're all going to be living pretty closely together. So being able to test more often will save people, from spreading. There's no official policy on that though, because it's just sort of the evolution of how contagious Omicron is and how useful it can be to know. Colin?
No, I think that's exactly it. The more rapid tests and the better mass you can bring, the better will it be. I did come across some links for insurance providers that will give insurance if you need to go in quarantine for accommodations. I can share those. I can't vouch for any of them, but some of them specifically mention Costa Rica. I can put it into the chat and let it up to each person to decide themselves if that's something they want to purchase. But it does cover for accommodation if you are in quarantine. I don't know what the cost or how good the providers are.
And we're starting to gather some of those too. So Costa Rica used to require travelers to come in with insurance that covers any quarantine stay. But now they're not requiring it if you are vaccinated, which you're all vaccinated. So you don't need this insurance. But Deb brought up ISOS. They are the people that help us find doctors, although we already have the go-to clinics that we want to use in Liberia and Monteverde and San Jose. But if you're in a small town for the weekend, ISOS will help you determine maybe the best doctor to go to, but it doesn't cover, it's not insurance that covers your hotel for an extended stay with COVID. but those insurance options are still there in Costa Rica. I looked at one, it was actually the Blue Cross version in Costa Rica, and it was about $300. It's like $293 for 31 days. And they have a national plan that's probably cheaper. I just didn't find the price yet. So that's something to think about. We're not, recommending, requiring, or vouching for any of them, but it's something that you probably need in place when you enter the country as insurance goes. Can't wait till you're sick to get it. It would then, I suppose, if a student had to, get quarantined mid-term, it should cover that cost so you could choose. Otherwise, we'll work with that within WPI. And I think we're all trying to update our masks and improve on our masks. Any other questions from anybody?
Yeah, go over it.
Colby, I didn't hear that. It's a little broken up, but feel free to type it too if. Anyone else, while we're waiting, if maybe Colby's typing something in? All right.
If anybody thinks of some questions after this meeting, feel free to email me. Oh,
Okay, we do have a phone question. You're not the only one to bring this up. I'm going to let the advisors talk about this because it is sort of your choice of, how are you going to enforce it and everything.
Yeah. Well, the question here, so it may work perfectly fine. This is what I've discussed with a lot of the students going to Monteverde. So it's something that's going to work for your parents to call you, for you to use if you pay $10 a day for Verizon or whatever your plan is to do that. The trick, and this is one of the huge issues, right, is that means that anybody who needs to contact you, that's your sponsor, anybody who's getting back to you for an interview who might be doing this through some other mode that's not email, they're going to have a long distance call to your phone. And that is prohibitive for many people. And so that causes a problem for our folks in these small communities. And it also, having that separate phone that is working in country gives us more assurance that we're going to be able to reach you, not with VoIP and things that are, but actually through a phone as an emergency measure. And so that, I believe, is the reason why in general WPI has required a local phone number for everyone. Even though your phone works and your parents may call you on that plan, right? So you could have two phones there, one that has your camera and has these other things, but one that is basic and lets other people call you for in-country costs.
And lets you call restaurants to see if they're open. It'll cost about $15 for everyone to get a SIM card there that gives you data and minutes. And often they come with free unlimited WhatsApp. And that's what most people use in Costa Rica. It's something you can do right away. When you land in Liberia, definitely should be done before you get to Monteverde. And in San Jose, it's super close, just behind the hotel is the mall where they have all the Colby movie star offices in that mall. So as long as your phone is not brand new and under a payment plan, you should be able to get one that's unlocked. if you're trying to unlock a phone, you should be doing that now because it can take a week for some phones to get unlocked when they have to like send you a code and all this stuff. As long as you have one that's paid off, old phone, you can add that cheap SIM card to it. They serve different purposes, this having an international plan with an American number and having a local phone number. And definitely be aware if you have the Verizon thing that's going to be $10 a day to have it work over there. That's a lot. That ends up really adding up compared to the local option. And we used to always have to buy flip phones. So, you know, we go abroad and buy a kind of a cheap phone, but now everyone has something laying around. A friend, you know, we used one years ago. Is there any estimated cost of what the SIM cards will cost there? It's the whole plan that will be like $15. And I think it might be like 1,000 colonne to get the SIM card, and then you have choices of your plan. But be aware not to just get a plan for a week, but to get a plan for a whole month. And I think when I was in the Monteverde class, someone looked it up right then and knew it was about $15. I think it might have been 17 at one point.
You kept saying that you used to get these flip phones for this, right?
Mm-hmm.
Is there any reason you couldn't use a flip phone for this?
I'm wondering if it's like old school 2005 flip phone that you still have laying around your house, if it just wouldn't be the right, if it's like analog at this point. You could bring it and try. You could put someone else's SIM card in it right now and see if it picks up on the new service. And also, most of the cards that you get in Costa Rica, they come in like multiple sizes. So there'll be the bigger SIM card that you can pop out of the template down to the micro sized SIM card. So it should be able to fit all different phones. And if you have extra phones, you can bring them in, you know, to see if anybody else on your team or in your cohort needs access to a phone. Creighton says he's bringing his old flip phone. So in San Jose, he might not be texting you back so quickly.
All right, thank you.
Mm. Phones always do cause lots of questions.
Yeah, yeah. Do we have any others? Okay, we want to thank everybody. Melissa, thank you so much. That was some great information. Sarah
Thanks, Deb.
and Creighton and Ulrika. I know Ulrika has already gone off, but thanks everyone for attending. And like I said, if you have any additional questions, please feel free to email me. And I will get out the information to you after lunch this afternoon. Thanks everyone, and enjoy your trip.
Thanks. Mm-hmm.
And good luck to you
We're
all.
we're stuck on these complicated logistics of getting home and staying safe, but
Yeah.
I'm so excited that you all get to go.
Yeah. Good luck.
Thanks, everyone.
Thanks.
And for my folks, I'm going to get tested and I'll be back with the test kits shortly. They've all left already. All righty.
Bye, folks. Thanks.